For the last couple of days, we've all been talking about Gord Downie and the Tragically hip, right, and his battle with brain cancer. Yesterday, the hip announcing they're going to start touring this summer, coming here to Calgary. This play in the Dome on August 1st. Our health specialist, Leah Sarich, with what kind of brain cancer this is now and how Downie could tour with terminal brain cancer. A lot of questions around this, right? A lot of people confused. I mean, how can he perform if he has a tumor? You know, the whole
you think
thing.
Brain cancer, you think, how is this guy going on tour, right?
Exactly.
So that's why we decided to look into this. So the type of brain cancer Gord Downie has is called glioblastoma, and it's actually the most common kind of brain cancer, but it's also the most aggressive kind as well. Yeah,
okay.
So it's also very aggressive. It occurs in about 3 in 100,000 people, and it can happen to anyone at any age, but it's most commonly diagnosed in men around the age of 60.
Oh, it's gender specific, mostly men,
Not
right?
necessarily.
Oh,
It can
okay.
any age, any gender, but most commonly,
Mostly guys,
yeah, in men, yeah, at that age. So there are reports. Downie was just walking down the street one day and had a seizure.
Oh, wow.
And then wound up in the ER. And in fact, the neurosurgeon I spoke to said that is often the way glioblastoma is first detected. That's the very common first symptom.
The most common symptoms are headache, seizure, or a neurological deficit, and those vary depending on the location of the tumor. That's why it's difficult to, pinpoint one specific symptom or a set of symptoms, because depending on where in the brain this occurs, that dictates what the patient's symptoms will be for the most part.
Because, of course, different parts of the brain control different parts of the body and mind. So the first-time seizure in an adult is always worrisome. So that's something to be very concerned about if that's a first-time seizure. So what happens then is the patient recovers usually from that seizure quite well, but then they're off to the emergency room to figure out why did they have that seizure. So that's usually involves some kind of diagnostics. So they'll start with a CT scan first, and then if the CT scan picks something up, then they're referred on to an MRI scan. And that's when they're going to have a look at this tumor and see what's going on. So that's, in fact, what happened with Gord Downie. So had the MRI, said, okay, yeah, we've got a tumor in there. And then based on what that tumor looks like and how aggressive it is and what it's doing and what kind of symptoms that patient is having, then they'll determine a course of treatment. And then they'll put the patient on anti-seizure medication until they figure out, okay, when are we going to do surgery to get that tumor out of there?
Yeah, and regards treatment, I mean, are there many options when it comes to something like this?
Yeah, so the standard course of treatment, which in fact Downie went through, is basically you start with that surgery to take the tumor out.
Okay.
And then you do chemo and radiation, just as with any other cancer or many cancers, and then you move on from there. So basically, Gord Downie right now has no tumor in his head. That tumor's been removed. He's had chemo and radiation, and that is sort of the standard course of treatment because generally patients will do well for a little while after that, depending on how they respond to that treatment. So the reports are that Downie has done very well with that treatment. So he recovered really well from the surgery, and he did really well through his chemo and radiation. Now, the neurosurgeon that I spoke to, Dr. Kelly, he says that's great for Downie, but that's not always the case. So to be very clear, not everyone does as well as Gord Downie has done with that treatment. Some people, he said, from surgery can even never wake up from the surgery ever again. Some can wake up but then have some kind of deficits, either neurological or in terms of function, things like that. Some people don't respond that well to their chemo or radiation either. Sometimes they have extreme fatigue and never really get the energy back enough to maybe go on tour, for example. Exactly.
That's
but
what I was
Gord
wondering.
Downie has done so well that he can, in fact, tour this summer.
Okay, so why is it called terminal brain cancer if he's responded so well and the tumor is out of his head right now?
Very good question, and that's a question I asked Dr. Kelly as well.
It's incurable because the tumor infiltrates into the brain, cells spread widely and deeply beyond the margins of what we detect with an MRI scan. So you can't remove it completely surgically, and we treat it after surgery with radiation and chemotherapy, but those agents don't kill all of the remaining cells.
So some of the cells are...
Yeah, and they're microscopic. That's the issue. So you're just not going to be able to see them, even with an MRI, which is, of course, very, very detailed. But it's just impossible to get all the cells because you just simply can't see them. So that's impossible. And what's also impossible, and this is the really hard part, is to determine then when those cells are going to create another tumor. Yeah. So in most cases, that's what happens. These tumors come back.
They do come back.
So he will be followed, and hopefully they'll find it again early, and they'll go in and do do the exact same thing.
And keep going. Okay.
Yeah.
And what's the name of this cancer again?
Glioblastoma.
Glioblastoma.
There you
you
go.
go. BreakfastTelevision.ca. We're going to put all this information on Leah's blog.
You
If
bet.
you want to watch the video again, also hit up that website because it's, well, everyone's talking about what's going on
Absolutely.
regarding Gord Downie. There you go. 7:40.